Hi, my name is Annie Lee, and I'm a psychotherapist here at Choices, and we are happy to offer an IOP program for adolescents and adults for eating disorders. Eating disorders is commonly seen as a problem that affects primarily young females. However, this is not necessarily true anymore, as we are often seeing people affected with an eating disorder as young as 6 or 7 years old, as well as into their late adult years of 60s and 70s. And we also see it affecting both males and females. It also crosses cultural, race, and ethnicity, as we don't see it only in females, white females any longer, but we also see eating disorders commonly in Latinos, Latinas, as well as African Americans, as well as Asians. So there are 3 primary types of eating disorders. They are anorexia nervosa, bulimia nervosa, and binge eating disorder. So in brief, anorexia nervosa is primarily when an individual restricts their food intake. They become very controlling of the amount of calories and or type of foods that they're eating, as well as becoming very rigid in how they approach their foods. They might become very ritualistic in their eating habits and behaviors. And oftentimes their weight will start to decline so that they become 85% or less of their ideal body weight. In bulimia nervosa, a person engages in binge eating, which is eating a large amount of food in a short period of time, feeling very out of control, and then doing some sort of compensatory behavior, such as using laxatives, using diuretics, vomiting, or over-exercising in order to get rid of the calories that they just consume. This needs to occur at least 2 times per week over a course of 3 months to be considered someone having bulimia nervosa. And the third most common eating disorder is binge eating disorder, which is when a person, again, binges on a large amount of food in a short period of time, but they don't engage in any compensatory behaviors like the person with bulimia nervosa. And this generally has to happen at least once per week to be considered someone who has binge eating disorder. There's other classifications of eating disorders as well, which is basically called EDNOS for people who fall not quite into the specifics of each disorder, but might have a little bit of each symptom or behavior, so they can't really be classified as any one of the 3 that I just mentioned earlier. At Choices, our program really addresses the underlying issues of the eating disorder, not just looking at the symptoms. So we are working with them to help them learn healthier coping skills so that they're not using food as a means of coping, but we also want to address the underlying issues to help them resolve the problems that are prompting their disorder.